Moderna has released the results of a new study that shows its vaccine works against some emerging variants of the coronavirus. The study found Moderna vaccines protected against two variants, one found in the UK and the other in South Africa. The drug maker says its vaccine is just as effective at blocking the British variant as the original strain of the virus in the study. It also found that while the drug's ability to fight the South African variant was reduced, it was still enough to protect against the virus. So I want to bring in Dr. Ron Elfenbein. He is the medical director and owner of FirstCall Medical Center. Thank you so much again. Good to see you this Monday. Dr. Elfenbein, Moderna performed this study on their own vaccine. It sounds like it's good news, but it's not a peer-reviewed study. You know, this has been happening a lot during the pandemic. Maybe it has something to do with just how fast we're moving, that, you know, we do tend to report on studies that the drug companies themselves have done that haven't actually been sort of double checked. But we're giving them the benefit of the doubt. So what do you make of the information that we're getting?
Yeah, so this was a study that Moderna did because of the two variants, the so-called B.1.1.7 variant from the UK and the B.1.3.5.1 variant from South Africa, because people have been concerned. We discussed this last week. You know, I said the word concerning is a better word to use than worried. I still stand by that. So what they did, as you said, Anna Marie, is they basically did it in a study in a laboratory. Again, this is not in a human body. This is in a laboratory. And as you pointed out very, very correctly, this has not been peer reviewed. This is just Moderna using their own internal data. But they showed that the efficacy of the virus against the UK variant was essentially the same as the original variant or the original virus. And the effectiveness of the vaccine against the South African variant was actually sixfold. The antibody levels dropped sixfold against this particular variant, but it was still effective. So again, no reason to panic, no reason for people to worry. The vaccine is still effective against the South African variant, but it has a sixfold decrease in its effectiveness, but it still reached the threshold level that they would consider effective. But again, this was a study done purely in a laboratory, not in a human body. So they're just looking at the effectiveness of the antibodies, nothing else. And I want to emphasize that the human body and the human immune system specifically is way more complicated and way more interesting than this study kind of lends itself to the data to look at.
Dr. Elfenbein, as you may have heard, Dr. Fauci was on CBS this morning earlier, where he said the president's plan to vaccinate 100 million people in 100 days was reasonable. He also laid out some of the obstacles in the vaccine rollout. Let's play some of that.
It's not easy to get doses from where you go in the vial all through the transportation into people's arms, particularly when you get out of the realm of giving it in a hospital or giving it in a nursing home, and you've got to go out into the community, particularly underserved communities, to get it to people. So if people think that's easy, it's not. It gets hard, and it'll get harder. Do we think we can do it? Absolutely, we think we can do it.
So what are your thoughts on that? It does strike me, and a lot of reporters have asked President Biden this. In fact, one Zeke Miller asked the president about the 100 million vaccinations in 100 days as being kind of low. So we're already kind of even doing more than 1 million a day. Shouldn't the goal be a little higher?
Yeah, I mean, I think that we should try to vaccinate as many people as we can, as fast as we can. But I think that they're trying to sort of, you know, I'm guessing that they're trying to under-promise and over-deliver, I guess, is the best way to say that. You know, set expectations low and then exceed expectations. Dr. Fauci is absolutely right. This is, again, we've discussed this many times. It's really a logistical nightmare when you think about having to give 2 doses of a particular vaccine, and that there are 2 vaccines currently that are FDA authorized for use, and you have to give the same person the second dose of the vaccine that they got. You can't switch vaccines. You can't give one, you know, Pfizer dose and then give a Moderna dose. If they get their first dose as Pfizer, they have to get the second dose as Pfizer, and it has to be either 21 or 28 days apart. So, you know, this is a really massive logistical undertaking. And, you know, in medicine, we know that patients are very non-compliant to begin with. So when you have an entire nation of people that need to get vaccinated and you have to get them to show up twice, it's very, very difficult to do that. And it's very, very difficult to keep these vaccines safe and to keep them secure and to keep them at the proper temperature and make sure they're handled properly and all these things that is so difficult. But look, I mean, we have the infrastructure. We do it every year for influenza. We do it for, for various things. We've gone into the communities before. This is not unprecedented. I mean, back in the, many decades ago, we did it for polio. So, there's a playbook for this, and we can do it. I'm not suggesting it's exactly the same thing as was done in the past, but we have the infrastructure and we have the capability, and we should be able to do it. So, yes, I agree with you. 100 million doses in 100 days seems very low.
Doctor, I want to go back to this new variant, the UK variant. There's some early research that suggests that it may actually be deadlier than the original coronavirus. Preliminary data, but it's showing that the new variant kills 13 in 1,000 people compared to 10 in 1,000 people. Early data, I want to underline that like over and over again. But, I got to ask you, just how concerned should we be? And I don't know, is this, how normal is this? I felt like we've gone like maybe 6 or 7 or 8 months, and it was just sort of the regular old coronavirus. And then suddenly, out of the blue, we hear about UK version, we hear about a South Africa version, we hear about another version here in the US that might be sort of a homegrown version. Is this normal?
So yes, Anne-Marie, this is normal. This is what happens with viruses as they, in a pandemic and as they take hold. Specifically with coronaviruses, they're fairly mutagenic viruses. They tend to mutate at a reasonably high rate compared to other viruses. So you would expect that over time there'd be multiple variants of the virus. Also, while we are putting downward pressure on the virus with the vaccine, the virus, like any other microorganism, will attempt ways to kind of counteract that and to go around the defenses that are being produced by the host organism, in this case, the human bodies. So, it's just natural selection. As you're putting downward pressure on in any way, the microorganism kind of tries to get around that downward pressure, and that's exactly what we're seeing. So, I'm not sure how much of these new variants are due to specifically people getting vaccinated, but I'm just saying that as people develop vaccines and or treatment options for various microorganisms, the bugs, in this case a virus, will figure out ways to kind of sneak around that. And we're hoping that, obviously, that the vaccine, in this case, that doesn't happen. But yes, this is entirely normal, and this is kind of what we'd expect. The fact that the preliminary data, as you rightly stressed, it's very preliminary, shows a slightly higher mortality rate. Again, I would advise your viewers not to get worried about this. It's very preliminary. And it hasn't been really studied yet. Even Dr. Fauci, I think, said that yesterday or this morning, I can't remember, that we really need to look more deeply at this data before we start worrying about the fact that it may be more deadly.
All right, Dr. Ron Elfenbein, as always, my friend, thank you very much.
Thank you, guys. Stay safe.